How many of you have hopes and dreams? Yeah. If you're a Pisces like me, you've had many. But as I've gotten older, my dreams have become a bit more down to earth. I no longer dream about traveling to Mars or becoming Beyonce, even though that would be pretty cool. But what I do dream about, and often, is creating a life for myself and my future family that I can be proud of. I literally think about it in my sleep. Like many of you, I've spent countless hours studying for exams, going to interviews, on the phone with student loan representatives, inching my way towards creating this purposeful and fulfilling foundation. And somewhere along the line, I came across the profession of city planning. The name sounded cool, the work seemed to be fulfilling, so I did what all millennials do when we find something interesting. I went to grad school for it. I was on my way. A cool, fulfilling career, check. A family of 4 with a cute little kitten. We still working on that one. But as I continued my studies, I began to realize just how disconnected the profession had become to people. And not only was it disjointed in ways that I didn't expect, it was harmful. City planning, the profession that I chose with such great confidence, was especially harmful to people that look like me, Black women. And the harm that's been endured by Black women from city planning policies penetrates beneath the skin, affecting our ability to lead healthy and happy lives. It was like I was in a hamster wheel, chasing after a dream through the same means that sought to destroy it, getting absolutely nowhere. If we take a look at housing, a staple in the profession, we see that city planning has had some pretty strong and many times negative connections to Black people. Through redlining, different housing acts, urban renewal, homelessness, even the foreclosure crisis, it's all led us to our current state of housing instability. It's no surprise that Black people, through racial segregation and discrimination, have experienced the brunt of these issues. It's also been proven time and time again just how important housing is to health. So it makes complete, logical sense to connect biased city planning policies to housing instability, to general health, to women's health, and then to maternal child health. Maternal deaths began to rise in this country in the 1990s, just as the federal government converted traditional public housing to the Hope 6 program, a program that was supposed to deconcentrate poverty and give people more options, but instead displaced thousands. By 2013, the maternal mortality rate had more than doubled in this country. Today, the United States is the only industrialized nation whose maternity mortality rate is on the rise. The CDC estimates that between 700 to 900 new and expectant mothers will die each year. An additional 500,000 women will experience life-threatening postpartum complications. More than half of these deaths and near deaths are totally preventable, and a disproportionate number of the women suffering are Black. Black women are 3 to 4 times more likely than our white counterparts to die from maternal mortality. Instinctively, it's easy to say that this is a public health or a healthcare issue, and it absolutely is. But there are other professions that have contributed to this epidemic as well, including city planning. If we take a look at the chaos theory and the butterfly effect, we see that it's part of a larger systems approach. And this system approach states that small variances in initial conditions can lead to cascading, widely divergent, and profound effects that lead to unintended and unexpected outcomes. An especially vicious, unintended consequence of biased city planning policies is that Black mothers are dying, many times with the help of city-specific social determinants of health. If we look at Black maternal mortality through this lens, we see that it's a bigger issue than any one field of study or profession. In fact, it involves us all. Whatever we do for a living and how we live our lives, if we think long and hard enough, it affects the state of Black women in our country. Can we now see how a seemingly unrelated profession like city planning directly impacts Black women so soon after the miracle of giving birth? And this is just one example. If you can make the connection, do you feel some moral obligation for those who have contributed to the epidemic to contribute to fixing it as well? Listen, you don't have to answer that question right now. I know it's a big one, and I've ran through things pretty quickly so far. But can I be honest with y'all? The link between city planning and Black maternal mortality wasn't always as clear to me as it is today. In fact, it wasn't until recently that I began to make the connection, and it got so strong I literally couldn't ignore it. I've experienced my own reproductive issues, and those experiences led me down a deep, deep rabbit hole researching the reproductive history of Black women. It was like an outlet for me. I had to read books about it, articles, go to meetings, watch documentaries and films. It became a way for me to release and somehow make sense of what had happened to me. But my research took up a lot of time. And if anyone can relate, as a full-time design student, you don't have much time to do anything but crawl your way towards graduation. It was also around this time that I decided that after I graduated and lived out my best city planning dreams, I would become a birth doula. Yeah, you heard it right. Your girl switched it up. I went from wanting to build buildings to birth babies. And for months, I spent my life living in these two worlds separately. An Ivy League city planning student that cranked out LIHTC applications and pro formas by day, and a Black woman trying to heal and navigate through this murky, volatile experience of reproductive trauma by night. It was also around this time that Dr. TEDxPhiladelphia came to our school as part of a lecture series. And her visit came at the perfect time. It was like the 12-pack case of extra-strength super glue I didn't know I needed. She helped to bind it all together. Dr. TEDxPhiladelphia coins a term called root shock. Root shock is the profound traumatic stress experienced when a neighborhood and its interpersonal ties are demolished. In her book, Urban Alchemy, she focuses on root shock's effects on public health, caused by, check this out, urban renewal, a set of city planning policies I knew all too well. That's when the light bulbs went off for me. If city planning policies can cause root shock, and root shock can affect public health includes women's health issues, and pregnancy, and birth, and babies, and boom, there it was. I decided that I would spend my last semester studying the connection between Black maternal mortality, city planning, and how city planners like myself can help. Picture this, a new Hippocratic oath, do no harm through planning. Yes, city planners, I'm talking to you. I'm talking to us. What if we use our education and skill to help keep Black mothers alive? What if before we all accepted our jobs, we took an oath that began with do no harm, that aimed to heal instead of hurt, that put people and community above bottom lines? What would the Black maternal mortality crisis look like then? But before we can seriously consider a world where Black maternal mortality isn't a thing, we gotta keep it real with ourselves and acknowledge one of the biggest factors at play, and that's racism. Yep, I said the R word. I know we don't like to talk about it. Some of us think that it doesn't exist, but it does. And it's affecting Black mothers in a way that can change the best day of their lives into the last day of their lives. And racism and discrimination not only affect medical bias in the healthcare system, but it's clearly demonstrated throughout contemporary America. There's literally no place in this country where a Black person can be free of judgment. Our schools, our hospitals, even our neighborhoods exist through the legacy of racism. And wherever inequity exists, we gotta point it out and work to get rid of it. I'm not telling you that the Black maternal mortality crisis will be solved by city planners and our new Hippocratic oath, or that racism will be eradicated if we all work together to keep Black mothers alive. I don't have all the answers, but I do know this. There's something inherently wrong with the system that doesn't value the lives of Black women. And this is more than a women's health issue. Thank you. This is more than a women's health issue. This is a human rights issue. Ask yourself this: what does it mean to be a good neighbor to Black mothers? For city planners like myself, being a good neighbor must include harnessing the strength and power of Black reproductive history in order to battle these disparities. At its core, universities can do a better job of linking city planning curriculum to real people, real places, and real problems. There's literally no better place to explore innovative, blue sky, and radical approaches to some of our country's worst issues than within the walls and with the resources of an academic institution. City planners can also act as advocates for equitable policy to make sure that doulas are accessible to everyone, regardless of where you live or how much money you make or what type of health care coverage you have. Minnesota and Oregon have a policy where Medicaid covers doula services, and New York City recently launched a similar pilot program. What about housing programs specifically catering to the needs of at-risk pregnant women and mothers that can stabilize and positively impact their circumstances before and after birth? The Boston Public Housing Authority and their Public Health Commission have been doing this for years and have seen immeasurable success. What about incentives for the construction of non-hospital birthing centers that can totally alter the course of a woman's birth, giving her a more holistic experience? As a resident of Philadelphia, the 5th largest city in this nation, there's no reason why anyone should have to travel to the suburbs to get services from a reputable birthing center. For city planners, being a good neighbor looks like using policy, design, real estate development, and funding opportunities to heal, to consciously elevate women, pregnancy, and birth. For all of us, being a good neighbor looks like recognizing we're all connected, no matter what we do for a living or what we look like. It means that the way we live our lives directly impacts someone we may or may not see. It means that we're all actively working to preserve or abandon inequities that have plagued our communities for way too long. Today, the connection between city planning and Black maternal mortality is stronger than ever for me. As you can see, I'm pregnant. Yay, yes. And I'm Black. Yeah. And I'm well aware of the cards that are stacked against me. Just because I'm well educated and I have a good job with good benefits and I got chosen to do TEDxPhiladelphia, it doesn't keep me safe from this epidemic. I also know that I made no mistake in choosing city planning to be my profession. For me, city planning is more than just erecting a nice building or putting a green space in somebody's neighborhood. It's about enacting change through design, policy, and grassroots efforts. It's about implementing the infrastructure for a city to thrive, including the people that have been many times left behind. It's about undoing and unlearning the things that got us here in the first place, challenging politics as usual, and ensuring the health of the city. In my ideal world, a world where we're all good neighbors to each other, Black mothers are valued. Healthy Black moms and families are an asset to us all. It doesn't matter how red, green, or blue you are, ensuring the health and safety of Black mothers crosses the aisle. In this ideal world, we look far enough inside each other that we see glimpses of ourselves. In the words of the Black Mamas Matter Alliance, in this world, women have the rights, resources, and respect to thrive before, during, and after pregnancy. In this world, I don't carry my son for 9 months, bonding and growing, only to leave him behind for no good reason at all. In this world, I live happily, enjoying my pregnancy, knowing that I am valued, my voice is honored, and my child and I are safe. Thank you. So today, I leave you with a small but important task. Take some time to think. Really think about how you're contributing to help or harm Black mothers. It may be in a way that you didn't intend. And if it becomes too hard for you to imagine a Black mother that's affected, please remember me. Thank you.